In HealthWorks this morning, October is Breast Cancer Awareness Month, and if a woman has a lumpectomy or mastectomy, many women decide to have breast reconstructive surgery, and that's what we're going to be talking more about this morning. Joining us is Dr. Young Cho, a board-certified plastic and reconstructive surgeon, to talk about your options if you want to have reconstructive surgery. Good morning to you.
Good morning.
Let's talk about where a woman even begins to decide what to do. There are quite a few options, and they're very promising, aren't they?
Absolutely. There are a lot of different options depending on whether a woman decides with their oncologic surgeon or breast surgeon to have a partial mastectomy where a part of the breast is removed, or a mastectomy where the entire breast is removed. What I would highly encourage women is to consult with a board-certified plastic surgeon who has an interest in breast reconstruction to see what some of the options are for either of those scenarios. And one of the big misconceptions out there is that a partial mastectomy or lumpectomy, where only a portion of the breast is removed, can leave a significant defect in the breast mound and shape, and they feel that since they had breast conservation surgery, they don't need reconstruction. So they're sort of left out there not knowing what some of the reconstructive options are.
And the great thing is this, we're not just talking regular plastic surgery. A lot of this is covered by health insurance now, so it can really help make a difference in a woman's overall self-esteem. Why would someone want to consider doing this? I mean, it could be a real life changer, can it?
Absolutely. Reconstructing the breast after breast surgery is definitely a very important aspect of restoring the self-esteem for a woman who's had breast cancer. Sometimes the woman is so focused on just getting rid of the cancer and treating the cancer that they forget that there are reconstructive options to help them restore the breast mound.
Let's talk about oncoplastic surgery, fairly new, and it's really gaining popularity now.
Yeah, so oncoplastic surgery is really focusing on using some of the techniques that we have in other aspects of plastic surgery, whether it's a breast lift, whether it's a breast reduction, whether it's rotating some tissue from one part of the body to another, or techniques like fat grafting where we can fill in a portion of the defect that's been created when a portion of the breast has been removed.
How does a woman decide what way to go? Is it best just to talk with a surgeon, tell her, you know, her hopes, and then to go from there with his advice or his or her
Absolutely.
advice?
So breast surgery and breast cancer in general is a multidisciplinary approach. The plastic surgeon is really involved in the reconstructive aspects. Unfortunately, the majority of women go through breast surgery to remove a part or a full portion of their breast without consulting a plastic surgeon. Getting them involved early allows us to give the woman who's gone through this very big ordeal what some of their different options are.
Dr. Cho, I'm glad you came in to talk about this. I think with us knowing that 1 in 8 women will get breast cancer, for a woman who hasn't even thought about these things, it's really good to know what the options are out there.
Absolutely.
And for anyone suffering as well. Thank you for talking to us.
Thank you very much.
Good to see you again.